Hello guys, this is Trilok, I'm a dietitian. In my previous video, we discussed how nitric oxide helps relax blood vessels and improve blood pressure. In this video, I'll show you 7 foods scientifically proven in human clinical trials to improve blood pressure and arterial health. Let's begin with the first food, garlic. Garlic contains an active compound called allicin, which helps the arteries produce more nitric oxide. This relaxes arteries, improves blood flow, and helps lower blood pressure. It also improves endothelial function and reduces arterial stiffness. In a meta-analysis of randomized controlled trials, aged garlic extract reduced systolic blood pressure by over 8 millimeters of mercury in hypertensive patients. This makes garlic one of the most well-studied natural foods for improving blood pressure. Most people can safely consume 1 to 2 cloves of garlic as part of their daily diet. Crushed garlic is more effective than whole garlic because crushing activates allicin, the active compound responsible for many of its benefits. However, people taking blood thinners, those with acid reflux, or preparing for any surgery should consult your doctor before increasing garlic intake significantly. Leafy greens are one of the most powerful daily foods for lowering blood pressure, such as spinach, amaranth, arugula, and wheat greens. These should be part of your daily diet. They contain dietary nitrates, which convert into nitric oxide inside the body. Leafy greens are also rich in potassium and magnesium, which further improve artery function and help blood vessels relax more effectively. Consuming about 50 to 70 grams raw or 150 grams of cooked leafy greens daily can provide these benefits. In a randomized controlled trial, daily consumption of nitrate-rich spinach improved artery function and significantly reduced blood pressure. For most people, leafy greens are safe and beneficial. However, people with kidney disease should consult their doctor before increasing intake significantly because leafy greens contain high levels of potassium, and people taking blood thinners like warfarin should maintain a constant intake as sudden changes can alter medication action. One of the most powerful foods ever studied for lowering blood pressure is flax seeds. They are rich in lignans, omega-3 fatty acids, and soluble fiber, which improve artery function and help blood vessels relax more effectively. In a randomized controlled trial, hypertensive patients who consumed flax seeds daily for 6 months experienced a reduction in systolic blood pressure of over 10 millimeters of mercury. This is one of the largest blood pressure reductions seen with any dietary intervention. Consuming about 1 to 2 tablespoons or 10 to 20 grams of ground flax seeds daily can provide these benefits. Ground flax seeds are more effective than whole flax seeds. For most people, flax seeds are safe when consumed in normal dietary amounts. However, individuals taking blood thinners or those with digestive sensitivity should start with smaller amounts and gradually increase. Certain herbal teas can significantly lower blood pressure, especially hibiscus tea. It naturally inhibits an enzyme called ACE, which helps relax blood vessels, the same pathway targeted by many blood pressure medications. In a randomized controlled trial, daily consumption of hibiscus tea significantly reduced systolic blood pressure in hypertensive patients. This makes hibiscus tea one of the most effective natural beverages for improving blood pressure. Consuming 1 to 2 cups of hibiscus tea daily can provide these benefits. It can be prepared by steeping 1 to 2 grams of dried hibiscus petals in hot water for 5 to 10 minutes. For most people, hibiscus tea is safe when consumed in normal amounts. However, individuals with low blood pressure, those taking blood pressure medication, or pregnant women should consult their doctor before consuming hibiscus tea regularly. This might surprise you. Dark chocolate has been shown in clinical trials to lower blood pressure. Dark chocolate improves blood pressure through its flavonoid content. These compounds improve endothelial function and help blood vessels relax more effectively. In clinical trials, regular consumption of dark chocolate has been shown to significantly reduce blood pressure and improve vascular function. This makes dark chocolate one of the most enjoyable and evidence-based foods for improving blood pressure. However, the benefit comes specifically from high cocoa dark chocolate. Chocolate containing at least 70 to 85% cocoa is recommended. Milk chocolate and highly processed chocolate contain much lower flavonoid levels and do not provide the same benefit. For most people, moderate consumption of dark chocolate is safe. However, excessive intake should be avoided as chocolate is calorie dense. Another powerful fruit shown in clinical trials to lower blood pressure is pomegranate. It is rich in polyphenols, which improve nitric oxide availability and help relax blood vessels. In human clinical studies, regular consumption of pomegranate juice significantly reduced blood pressure and improved artery function. Consuming about 50 to 100 grams of pomegranate seeds daily or about 100 to 150 milliliters of fresh pomegranate juice can provide these benefits. For most people, pomegranate is safe and highly beneficial when consumed in normal dietary amounts. One of the most powerful nitrate-rich foods for lowering blood pressure is beetroot. It has an exceptionally high nitrate concentration compared to most commonly consumed foods. It contains dietary nitrates, which convert into nitric oxide inside the body. In randomized controlled trials, beetroot consumption has been shown to significantly reduce systolic blood pressure in both hypertensive and healthy individuals. This makes beetroot one of the most powerful natural foods for improving blood pressure. Consuming about 100 to 200 grams of beetroot daily or approximately 1 glass of beetroot juice can provide these benefits. For most people, beetroot is safe and beneficial when consumed in normal dietary amounts. You don't have to consume all of these foods every day. Including a few of these foods regularly in your diet can provide significant benefits. If you want to prioritize, focus on garlic, leafy greens, and flax seeds. These have some of the strongest clinical evidence and are easy to include in daily meals. The other foods can be rotated regularly as shown here. Checking your blood pressure regularly is also important. Aim to check at least 3 times per week and keep your doctor informed about your progress. Improving artery health takes time, but with consistent dietary and lifestyle changes, you can significantly improve blood pressure and overall cardiovascular health. I hope this video was helpful. Thank you for watching Nutritional Perspective. I'll see you in the next video.